Good morning, class. Good morning, professor. Today, my topic of presentation is about COVID and the importance of COVID-19 testing. And first, let me introduce what coronavirus infection is. Coronavirus infection is a disease transmitted by COVID-19 virus. And COVID-19 virus is first identified in the city of Wuhan, in the region of Hubei in China. And it has resulted an ongoing pandemic. And the common symptoms include fever, cough, fatigue, shortness of breath, and difficulty of breathing. And it has also causes loss of smell and loss of taste. And the disease spreads most of the time when people are physically close to each other. And the recommended measures to prevent the infection include frequent hand washing, social distancing, and covering when we cough and when we sneeze, and keeping unwashed hands away from the face. Regarding to the diagnostic tests, there are different literatures and different papers written by different scientists. For example, the author Sarah Tiner on 16 June 2020 on the topic of the importance of antibody testing in addressing COVID-19 states that for COVID-19, a specific protein from SARS coronavirus 2 virus is used as a target antigen in the ELISA to detect any antibodies in the patient's serum that can recognize the specific viral protein. She recognizes the importance of serology and how much it can continue to fight COVID-19 infection. And one new test, in the ELISA. ELISA is an acronym that stands for enzyme-linked immunoservant assay, and this is a reliable test. And different clinics, including the Mayo Clinic, recently selected one of the ELISA that shows excellent clinical sensitivity and specificity. And as a part of clinical trials, it is very good to isolate convalescent plasma donors and patient testings. And the whole concept of increasing COVID testing is for treating patients and preventing healthy people. And the authors Ken Altek and Ramon Parilla on September 23, 2020, they say the United States needs 30 million tests in a week to adequately track the virus and protect risky residents. By now, the nation only reached only 1 million daily tests for the first time last week. This is because it helps to control the pandemic by treating infected people and tracing exposed people and to quarantine them. In addition, the website COVID-19 Science on the topic of why testing is so important explained that the diagnostic tests leads to quick identification of cases, quickly treatment for those people, and immediate isolation to prevent the spread. This early testing helps to identify anyone who comes close in contact with infected people and to treat them quickly. In other words, the widely distributed rapidly diagnostic tests helps to diagnose patients and help to control the spread by early detecting those who have contacts. And regarding the tracing and isolating suspected cases, author Anthony Wood in the meeting of World Economic Forum describes that the Director General, Dr. Tedros Adhanom, says if the test is positive, we should isolate them and we should trace those people who have contact with them before they develop symptoms. And according to CDC, CDC is the Center for Disease Control and Prevention. Those recommended to be tested by the CDC are the following. One, those people who have symptoms of COVID, and the other is those people who have close contact with these COVID people within 6 feet, and those stayed 15 minutes in contact with these patients. And three is people who have been referred to get tested by healthcare workers, healthcare providers. This is because everyone cannot be tested because of a shortage of manpower, shortage of test kits. And let's go to the second use of the problem of this COVID, that is the economic crisis. So we need to reopen the economy. So as we know, the disease has economic and social crisis. And the author Mindy Luber on March 26, 2020 in Forbes magazine writes that as the world struggle to contain a rapidly spreading pandemic, hundreds of thousands of people are fighting for their lives and the global economy is in danger. This means this pandemic is a painful reminder of our social lives. And it is also carries, enormous risks and sudden shocks for our social well-being and our market system. So we need for mass mobilization to tackle the problem, because many people are becoming jobless and they become sick because of coronavirus infection. And the big question is how to reopen the economy. The author Pentland on April 30, 2020 in the topic of how to reopen the U.S. economy and keep the work safe, states that the common devastation caused by COVID-19 pandemic has been a swift, and the U.S. retail sales have been collapsed, and industrial production has fallen precipitously. Therefore, this is a widespread agreement among experts, and that restarting the economy requires more testing for the virus. And the reliable blood test for these people and safe to rejoin the workforce. In addition, every people should wear a mask and should go to work. So we need to adjust the problem, and the economy should be reopened with necessary precautions. And to reopen the economy, our health system should treat all patients without crisis, and to test all the suspected COVID cases with the full potential. And Dr. Patrice Harris, MD, on April 17, 2020, in the meeting of American Medical Association, said that we must expand the COVID-19 test capacity before restarting the economy. Of course, decreased COVID positive cases and symptomatic cases should be seriously considered before reopening the economy. So only through the expansion, we will have a data, only through the expansion of our diagnostic test, by increasing our diagnostic test, we will have the data and the information necessary for public officials and government officials to determine when it's too safe to resume our normal activity, when it's too safe to reopen our borders. So only we can safely send back people back to work, and students back to school, and all other activities as we enjoyed before the pandemic. So in conclusion, coronavirus COVID infection is a disease caused by coronavirus, and prevention is by avoiding close contact and hand washing, and COVID-19 is important. COVID-19 testing is very important to control the pandemic, to treat patients, to trace and to quarantine exposed people, and it is also practically very important to assess the situation and to restart our life to the era where there was no coronavirus infection. Therefore, until the researchers and the scientists find a good vaccine and a good treatment, we should emphasize prevention methods, and we will need to partially resume our economic activity by increasing our diagnostic and prevention methods. So, my class, be stay safe well and stay good. Thank you for giving your ears. Thank you. Do you have any question? Any comment? Okay. Thank you so much. Thank you. Thank you.